I'd like to start with a brief overview of this disease. What is follicular lymphoma, and can you break it down a little bit, the key differences between Hodgkin and non-Hodgkin lymphoma, and how follicular lymphoma fits into that?
Sure. The terminology can be kind of confusing to patients, so I'll try to explain it. Hodgkin lymphoma is a specific kind of lymphoma. Non-Hodgkin's lymphoma just means it's not Hodgkin's. So non-Hodgkin's lymphoma is just a big, broad, descriptive term. It's like saying automobile. But there are lots of different kinds of cars, obviously. So follicular lymphoma is a specific type of non-Hodgkin's lymphoma. So it'd be like saying, Chevy Malibu or something specific within that automobile term. So there's like 100 different kinds of non-Hodgkin lymphoma. Follicular lymphoma is one of those. And it's kind of a unique cancer, biologically and clinically. Follicular lymphoma is characterized by this particular mutation inside the cells that sends a signal to the cells that says don't die. So instead of being a disease of rapid cellular proliferation and growth, it's more of a disease of slow cellular accumulation. If people can picture that, the cells are just accumulating slowly. So it's kind of a slow-moving cancer. And probably when patients are diagnosed, they've probably had it for a long time already. They just didn't know it, because follicular lymphoma often doesn't cause symptoms. And usually when we get a patient with newly diagnosed follicular lymphoma, the disease is very widespread. And that obviously makes people fearful. And so we spend a lot of time trying to reassure them that's not a problem that's typical for follicular lymphoma. Everybody wants to know their stage, of course. And I try to tell them, the stage doesn't really matter that much in follicular lymphoma. In some cancers, the stage is a big deal. But those are cancers that you can kind of remove surgically. But there's really no role for surgery as a treatment in follicular lymphoma. The disease is typically very widespread at diagnosis, meaning it's all over the body. And so when we do treat it, we pick treatments that will work everywhere. And our treatments tend to work just as well when the disease is at a more advanced stage. That's why, as the doctors, we don't spend too much time worrying about the stage. It's not as important in follicular lymphoma.
Okay, thank you. And just to clarify, when you mentioned that there is a mutation or often mutations in follicular lymphoma, is that in the cancer cells themselves, or is that in a mutation like a BRCA mutation that a patient can be tested for? A person.
Right. Great question. The mutation is specific to the cancer cells. So people are not born with this mutation. It's not a mutation that you pass along in your family to children. It's a mutation that is acquired in these cells at some point in the patient's lifetime. Another confusing term is this whole idea of B-cell lymphoma or T-cell lymphoma. And just to try to clarify that, so we have different kinds of lymphocytes in our body. And these lymphocytes, they have jobs to do as part of our immune system. And one kind of lymphocyte is a T cell, and that has specific roles in our immune system. And another kind is a B cell, and that has specific jobs to do in our immune system. Follicular lymphoma is derived from a B cell, a B cell lymphocyte. So a B cell gets this mutation, and that turns it from a normal, healthy B cell into a follicular lymphoma cell.